Welcome to the module on cold wave. By the end of the module, you will be able to define cold wave, explain the causes of cold wave, explain the effects of cold wave on humans, explain how to protect from cold waves, illustrate the steps for pre-hospital treatment for hypothermia, illustrate the steps for pre-hospital treatment for frostbite and deep cold injuries, and explain the role of volunteers. A cold wave is a weather event involving a cooling of the air or the invasion of very cold air over a large area. It is marked by a drop of average temperature well below the averages of a region. The plains of North India regularly experience cold wave and cold day conditions during winter every year. It is a severe weather phenomenon which may even cause loss of life and crops. Cold wave is considered prevalent when minimum temperature of a station is 10 degrees Celsius or less for plains and 0 degrees Celsius or less for hilly regions. India saw 1,750 deaths due to extreme weather events in 2021. India recorded 2,227 human casualties due to extreme weather events in 2022. Let's learn about development of cold wave, its effects and injuries caused due to cold weather. Click each tab to learn more. Development of cold waves. A cold wave forms when cold air in larger volume shifts from one region to another. Cold waves so created can also be accompanied by extreme wind. This type of phenomenon is called as winter storm. Hypothermia and frostbite are caused due to extreme and especially unexpected cold. This condition could result in tissue damage and organ failure and thus required to be addressed medically. They can cause death and injury to livestock and wildlife. If a cold wave is accompanied by heavy and persistent snow, grazing animals may be unable to get adequate food and may die of starvation or hypothermia. Injuries due to cold weather. When a person is exposed to extreme cold temperatures, it may result in a decrease in body temperature and thus generates cold-generated medical issues like frostbite, frost nip, chilblains, and hypothermia. Frostbite is freezing of body tissue often accompanied with hypothermia. When ice crystals form between the cells of the skin and grow by extracting fluid from the cells, the circulation is obstructed, causing additional damage to the tissue affected. It commonly affects hands, feet, ears, nose and cheeks. Frost nip is a mild form of frostbite. Continued cold exposure leads to numbness in the affected area. Frost nip doesn't cause permanent skin damage. Chilblains is caused due to exposure to cold, wet and humid conditions between 32 to 60 degrees Fahrenheit. Repeated, prolonged exposure of bare skin lead to development only in a few hours. Ears, nose, cheeks, fingers and toes are most commonly affected. Hypothermia is defined as a lowered core body temperature usually below 34.4 degrees Celsius or 94 degrees Fahrenheit. The person is also prone to allied injuries like dehydration and snow blindness. Dehydration causes loss of body fluids to the point of slowing or preventing normal body functions. Dehydration increases chance of becoming a cold weather casualty. Snow blindness causes inflammation and sensitivity of the eyes caused by ultraviolet rays of the sun reflected by the snow or ice. Let's learn about hypothermia warning signs and symptoms. As discussed, exposure to excessive cold can cause mainly two types of emergencies, hypothermia and frostbite or local cold injuries. Let's learn about them in detail. There are two types of hypothermia, mild and severe hypothermia. Click on each tab to learn more about the warning signs and symptoms. Signs and symptoms of mild hypothermia include sluggish pupils, when pupil constricts slowly in bright light, uncontrollable shivering, cold chills from being exposed to low temperature, chills. Chills refers to feeling cold after being in a cold environment, drowsiness. Drowsiness refers to feeling more sleepy than normal during the day. People who are drowsy may fall asleep even when they do not want to. Loss of vision means blindness or losing your ability to see well. Rapid breathing, breathing more than 20 breaths per minute. Slow pulse, heart beats less than 60 times in a minute. Signs and symptoms of severe hypothermia include rigid extremities, inability of the muscles of limbs to relax normally, extremely slow breathing, breathing rate below 12 breaths per minute while resting, unresponsiveness, not responding readily to any stimuli or command, extremely slow pulse rate, less than 45, which is extremely slow pulse rate, absence of shivering, absence of involuntary somatic motor response, that occurs in skeletal muscles to produce heat during exposure of cold. Environment, fixed and dilated pupils. Pupils dilate without a change in the level of light. Identify if the given statements are true or false. In case of hypothermia, patient needs to get hospitalized immediately. Hypothermia is a communicable disease. Is it true or false? Let's learn about more serious consequences of hypothermia. Click each organ to learn more. Hypothermia can have an effect on the brain and cause altered consciousness, apnea or coma. Altered consciousness is a change in one's normal mental state or any state in which a person's sense perceptions are different than normal. Apnea is when a person stops breathing or transient cessation or respiration. Coma is a state of prolonged loss of consciousness, including a lack of response to stimuli. Hypothermia can have an effect on the lungs and can cause aspiration pneumonia or adult respiratory distress syndrome. Aspiration pneumonia is when food or liquid is breathed into the airways or lungs instead of being swallowed, or accidental infiltration of food or other substances from the mouth or stomach into the lungs. In adult respiratory distress syndrome, fluids accumulate in the alveoli of lungs or life-threatening lung injury that allows fluid to leak into the lungs, or alveoli or lungs fill with access at fluids. Hypothermia can affect the intestine and cause gastrointestinal bleeding, which is bleeding that starts in digestive tract anywhere from throat to a rectum. Disseminated intravascular coagulation condition may occur, affecting the blood's ability to clot, or a condition in which blood clots form throughout the body, blocking small blood vessels. The patient may also suffer acute renal failure. It is a condition in which the kidneys suddenly can't filter waste food, the blood. the effect of hypothermia on heart can cause arrhythmias, where heart beats with an irregular or abnormal rhythm, irregular heartbeat. It can also cause pulseless electrical activity. The heart stops because the electrical activity in heart is too weak to make heartbeat. Let's learn about pre-hospital treatment for hypothermia. Use universal precautions as per protocol. Secure the scene and alert EMS. Conduct initial assessment and physical examination of the affected person. Maintain open airway and administer oxygen if needed. Remove the patient from the cold environment. Remove any wet clothing and cover patient with a blanket. Keep the patient dry. If the patient is alert, offer warm liquids slowly. Constantly assess vital signs. Next, let's learn about pre-hospital treatment for frostbite or local cold injuries. Pre-hospital treatment for frostbite is as follows. Remove the patient from the cold environment. Do not allow the patient to walk on a frozen limb. Protect the frozen area from further injury and refreezing. Dry the affected area and apply a clean bandage. Place dressings between the fingers if they are affected. If superficial, cover and keep warm. If deep, apply dry, sterile dressings. It is very important that frostbite is treated in initial stages. Let's take a look at what happens if frostbite is not treated. Later stages of frostbite is called as late or deep cold injuries. In this condition, the skin may appear to be very waxy and may be firm to the touch. As freezing continues, it becomes mottled and blotchy. Finally, the area becomes swollen, blistered and white. Let's see if you can identify these conditions. Drag the images in the appropriate drop boxes and click Submit. Answer the question. Select the appropriate answer and click Submit. Now let's discuss cold weather injury prevention in detail. Do not allow sudden drop in body temperature which can cause a heart attack or stroke. Cover head and neck. 80% of heat loss happens from here. Use synthetic and natural fibers to retain moisture. Do not stay for long time in cold areas. If you have to go out in the cold, then rest only at a shelter. Prepare a cold weather survival kit and keep it handy. Let's learn about what should be there in the kit. Preparation for cold wave. People should store water, food and other necessary items before a cold wave. Wear clothes that make you feel warm. Dress in layers if going outside. Store candles, flashlights, portable fuel and matches for wood used in fireplaces or stoves. Hospitals should prepare for the admission of victims affected by cold wave. Click the kit to see the items. Cold weather survival kit should have waterproof matches and fire starter like candle, magnesium match, lighter, pressure bandage, cold climate lip balm, sunglasses, multi-purpose knife, water container, metal for heating, small amount of high energy food, fall survival blanket. If you are on a mountaineering trekking expedition where your mobile does not work, you should have torch, mirror and whistle for help, and if you can lose your way, you should probably have a compass. Let's learn about the immediate care for victims suffering from cold wave. Firstly, cover the victim with warm blankets. The victim should be taken inside the house. Room heaters should be put on, warm broth and soup must be given, hot bath can also be given, soak the victim's feet in warm water. Make him drink warm, non-alcoholic beverages, chemical heat packs can be applied on the neck and armpits of the victim. Warm the victim slowly as rapid warming may lead to serious heart problems. If the victim is not recovering, call for the emergency medical services, make the victim take rest, do not allow the victim to walk. How to treat someone affected by cold wave? Get medical attention. Move the person out of the cold, remove wet clothing. Warm the person at the center of the body, chest, neck, head, groin. Do not use direct heat, use warm blankets, towels, wrapped warm water bottles or skin-to-skin contact. Do not massage or rub the person. Keep the person still. If a person is awake, warm drinks can help. Do not give alcoholic beverages. If the person is not responding, CPR should be given whilst the person is being warmed. Never assume the person is dead. Now, let's know about the instructions who are going to cold place. If you are a tourist going to a cold place, what are the precautions you should take? Check the forecast for a cold wave. Have local helpline numbers available with you. Keep your electronic devices charged so that if you get coverage, you can call for help or even navigate through latest apps. Take reserves of food and water in case you get caught in a cold wave. Don't go to wild areas without local guide. With this we have come to the end of this module. Let's recollect the key points discussed in the module. A cold wave forms when cold air in larger volume shifts from one region to another. Hypothermia and frostbites are the two main effects of extremely cold weather, which sometimes results in loss of life. Common signs and symptoms include loss of vision, chills, unresponsiveness, slow pulse, drowsiness, etc. Hypothermia can be treated by keeping the patient in warm and dry environment, serving hot beverages, etc. Frostbite can be treated by keeping patient away from cold and applying clean bandages on the affected area. Cold weather injuries can be prevented by taking proper precautions. Now, it is time to check your understanding of the topic. This is an evaluation exercise. All questions are equally weighted. You need to score at least 60% to pass the test. Read the questions carefully and select the appropriate options. Congratulations!